Hey, welcome to In Focus, your eye in the community. This is Rich Bella.
And this is Kathy Battersby Bella.
Welcome to our podcast. And today we have a special guest.
Dr. Param Gill has done over 10,000 dental implants. He's one of the best specialists in Central Valley, California. Thank you so much for being here.
Oh, thank you for having me.
So tell us more. 10,000 implants. How long have you been doing this?
25 years.
Wow, that's a long time. Do you just go for the implant or what's your process?
No, I had a group practice, so I was running 6 locations in Northern California for the longest time. I also do a lot of charitable work in hospitals where we place free dental implants. So, it all counted over the time.
Yeah, wow. I know that you are a specialist in dental implants, but you also focus on family dentistry, holistic dentistry. How do all those things fit together?
See, dental implants is not a specialty per se. You can call me an expert having placed so many. But again, I practice general dentistry. And families are my, I would say something that I call soul food. When I see happy kids, happy parents, it gives me immense joy. And so I've never stopped doing family dentistry, neither do I intend to.
How much does a dental implant cost, Param?
Cost varies. It depends. You can get very good deals with dentists who are starting out, who are not as experienced in dental implants. Those who are very well experienced, they charge a little more for their experience. But I always say that with dental implants, it's not about cost. Of course, get a second opinion, get some quotes. That's a good thing to do. But always go with someone who is experienced. So you want to know what type of implant are they placing in your mouth, because this is going to be forever in your bone for the rest of your life.
Wow.
So you don't want to short sell yourself in this regard.
So what do we need to look for?
Like I said, you need to look for an experienced dental surgeon who's going to place them, and you want to go online, check their reviews.
Are they always metal?
Are the implants always, they're always titanium.
Okay.
But you can also, there are some patients who are sensitive to titanium, so we place zirconia implants for them.
Okay.
And they do not leak any metal or anything.
So yeah, regarding the cost, you're going to definitely want someone experienced based on what Dr. Param is saying. And with 10,000 implants done, that's like the Bruce Lee of dentistry.
You could say that, but it's also a very humbling experience because, man proposes, God disposes. So we've seen some failures on our way, and it's always learning. No matter how many you may place 1 million, but every day you learn something new when you go out there and place them.
What happens if these things fail? What if they don't work out? Is everybody a candidate, or should some people go the dentures route versus an implant?
Dental implant is a very predictable procedure. Okay. Practically everyone is a candidate. And some patients who have, immune system suppressed due to a systemic disease or some autoimmune condition, we do not place implants. But generally, broadly, everyone is definitely a candidate for implants.
Now, I noticed that you talked about a lot of different things in your book. But one thing I did want to point out is you talked about malocclusion and when the teeth don't match. Does it still work if people kind of have teeth that are off, or do they need to repair that first before they get an implant?
See, first thing we do when any patient walks through that door is we check their occlusion. So thanks to technology these days, we do a wellness scan. So it's an intraoral scan, which tells us wherever they're hitting hard, which crowns are high, which fillings are high. So the first step is to adjust their occlusion before we go anywhere else, be it a filling or a crown or anything. So occlusion is paramount for success in dentistry, in any regard, in any field. Even with dental implants, one of the reasons why implants fail is malocclusion. The bite was not registered right, and that's why over time, when there is excessive, they're hitting too hard, the implant gives way.
I mean, I know a lot of people don't like pain. That's why a lot of people probably don't go to the dentist. So is there an option to have anesthesia, or is this something you just have to suck up and just deal with it?
No, no, you don't have to suck up. There are options out there. We have an anesthesiologist on board, so
Oh,
he can
nice.
put you out and you wake up with a new smile if you so wish. But we can also sedate you. It's oral sedation. Or we also can do it under local anesthesia. It all depends on the complexity of the procedure and on the patient. What is their anxiety level? And like you said, most patients who have bad teeth have severe anxiety towards dentist, maybe a bad experience when they were a kid. And so that's the reason why they do not seek dental care. So by the time they do, it's kind of late. So I always encourage, if you have anxiety towards dentist, don't let that stop you from going in for an exam. Don't let that stop you from just getting a cleaning.
Right.
And rest is up to you, whatever needs to be done, then you can take that call. But these days there are so many options.
And as a holistic dentist, you always remind us that it's not just about going to the dentist, it's what you're doing outside of the dentist, your diet. Tell us more about things like that.
Yeah, see, periodontal disease or tooth decay, these diseases are bacterial in origin. Another problem is our diet, excessive sugar in our diet. Anytime I see a patient with a lot of cavities, first question I ask them is, how much sugar do you consume and in what form? And generally they say, oh no, I don't consume any sugar. I said, okay, well then make a list of everything you ate during this week and then check how much sugar is in what. And they're generally surprised because sugar is hiding in everything. And so there is research out there that if you have something sugary and sugar is left on your tooth, say for even an hour, half hour, it can cause a cavity. So every time I would suggest that avoid sugar, but if you have to, then always brush right after you consume anything sugary.
And it actually is kind of a circle, right? Because if you have diabetes or if you have some of these other conditions, it can make your teeth brittle, right?
Yes. Makes it easy for you to develop gum disease. And one thing I do want to bring to attention is that what is gum disease? It is chronic inflammation, right?
Yeah.
And chronic inflammation is connected to your heart, is connected to your, cancer, is connected to rheumatoid arthritis. Inflammation is inflammation, whether it's in your gums or in the rest of your body. So go to your dentist every 6 months, get your teeth cleaned, and if you need deep cleaning, go get a deep cleaning. Oral hygiene, regular flossing, mouth washes. There are so many ways that you can protect your smile.
So back to implants. What is the success rate of implants?
Success rate of implants is significant. It's up to 98%.
98%?
Yes. The only reason implant would fail, one, either infection right after placement. Again, infection is bacterial. What we do before placing any implant is we use lasers for bacterial decontamination. So the chances of infection are very low. Other reasons you would lose an implant is if the occlusion, if it's hitting too hard, then the implant will fail. And then, of course, systemic diseases. If someone had controlled diabetes when the implant was placed, and then diabetes went out of control, that could cause an infection. Of course, patients on antidepressants, they have high rate of failure of implants. And the big one is vitamin D. If you are low in vitamin D, that's linked to implant failure.
Because of the bone.
Vitamin D works. It's some sort of immune response. It's very complicated to fully explain here, but it somewhat modulates our immune response. So that's why.
Oh, wow. Excellent. Yeah, people in a certain demographic, like where I went to high school, I could imagine, like, we didn't really take care of our teeth. It wasn't a thing. And, I think a lot of us, looked at it like it was like the least of our health concerns, But as I grew up and I grew older and matured, I realized, like, dental health is as important as mental health. We talk about mental health so much, but dental health is like a big clue to how sick you really are. Like you said, inflammation in the mouth is just a representation of your whole body. Holistically, we have to understand that this has got to be a part of the process. You know, so every 6 months, an exam, like I've seen it in other dentistries, not sure, you know, how it applies to yours, but it's not that expensive for an exam, just to know what the problem is and to just get some of the teeth cleaning to remove some of the occurring issues.
See, one of the reasons for that is insurance mentality. What is insurance mentality? If you've lost your job, you don't have insurance, you feel, okay, I don't have insurance, so they'll be expensive. And like you said, an exam or a cleaning is relatively inexpensive for anyone. One more reason is, okay, suddenly now you have a job and you have dental insurance and you go to the dentist and you have these 6, 7 cavities, you need a crown. Like, okay, do what my insurance covers. So what is the dentist going to do? Again, insurance mentality. Okay, let's do that crown or let's do that. You know, I always say have a long-term plan, regardless of whether you have insurance or not. You need to have a plan. You may not have money to do something today, but that doesn't mean that you can't do it tomorrow.
Right.
Cavities do not become root canals in a day. It's a process. So when you have deep cavities, address them first. So what happens, I've seen patients, they'll spend all their insurance money in doing that one root canal because that one tooth is hurting, and they leave that other 6, 7 cavities to get bigger. And over time, what happens? They become root canals as well. So this whole insurance mentality, this insurance mindset, see, dental insurance and medical insurance is very different. Dental insurance is like $1,000 coupon, which you can use towards something. That's all it is. It's not like medical insurance. But patients still, because that mindset, they feel that it's like medical insurance, so
Right.
you know. So the whole system is flawed, and that translates into our patients suffering.
Right.
So what do we do about that mentality?
Well, we try to make patients aware. Insurance companies don't make things any easy. You know what
Right.
insurance companies stand
Right.
for, was to pocket the profits, right? So we on our end try as much as we can. It's a collective effort. The entire dental community, CDA, ADA, they're all trying to bring awareness to these issues. But these things take time.
Quick question, just out of my head. It's like I just said something about like how the impact of your dental health is a reflection of your overall health. But how does that work the other way around? Like, does the dental health affect your actual overall health as well? Like, if you're not taking care of your teeth.
Does the overall health affect your teeth as well? Of course it does.
Yeah.
If you are diabetic, higher
Right.
chances of
Right.
periodontal disease, okay,
Right.
higher chances of infection, bone loss. If you have other systemic conditions, of course, that impacts your... So it's vice versa. See, whole body is connected.
Right.
Our medicine, dentistry, we've divided everything. This belongs to this doctor, this
Right.
belongs to this doctor,
Yeah.
but it's all whole you.
Right.
And you belong to you, you know?
Right.
So it's just all divided. So I've never had a cardiologist call me that, hey, dude, this patient has severe bleeding from the gums, and I'm changing his valve, or I'm placing a heart valve. Is there something you should do before I do this procedure? I've never had that phone call.
Right.
In fact, if I ever reach out to a cardiologist and say, this patient has recently gotten some valves placed and he has severe, periodontal disease, and what's your take on that? They don't think that dentist is a doctor. They're like,
Right.
no, heart,
Right.
right?
Right.
So that's what I'm saying. There's a disconnect between different doctors. The kidney doctor doesn't know what heart doctor is doing. Doctor doesn't know what ENT is doing. But it's all one body.
Right.
Exactly.
Holistic.
And your teeth are the gateway, right?
Yeah, there you go.
Exactly.
Exactly.
Yeah, I've never had one doctor ever call me that, I'm doing this serious surgery on this patient, or I'm doing this, and what's the condition of the mouth? I feel that they don't even look in there.
Right.
Why? Because it's someone else's job.
Now, see, you're connecting the dots, and a lot of people, like you said, doctors don't make those connections. Is it helpful for clients to understand these things are going on with your teeth? You might also want to see what's going on with your body. Is that connection ever made?
Yes. We often reach out to patients. For example, if a certain patient has multiple implants and they start to fail for no reason. They've been placed well, they've been fine for 6-7 years, and suddenly And like I said, for every patient, every visit, for all implant patients, we do bacterial decontamination around the implants to avoid any sort of infection around the soft tissue and connective tissue. In spite of that, some patients have implant failures, and then that's when I say, talk to your primary care physician, get a blood test done to see what's going on, what's your vitamin D levels, what's going on. So yeah, we have to reach out. There's no choice. Because if an implant fails, in my practice, we cover implants for 5 years. If a certain implant fails, we place it again at no charge.
Great.
But there is a reason why it failed, and if we don't fix it, it'll fail again.
Yeah.
But it's better to find the root cause.
Yes,
Yeah.
it's all connected, and it's better to find the root cause.
Absolutely, absolutely. So, taking this all in, your dental health is part of your overall health. Any takeaways here?
Well, I'd like to know what you'd like parents and families to understand about all of this. Like you're saying, a lot of times people are weighing between, do I take them to the dentist, or even more so, I'll take them to the dentist, but I won't go, right? And then now the kids kind of end up doing the same thing when they grow up. Like, I did it because that's what my mom did. When I went to the dentist, she didn't go to the dentist, and now that I'm grown up, I don't need to go to the dentist anymore.
Environment.
Right. So how do we break that chain of pain?
Yeah, step one is diet and lifestyle. The kids, I see a lot of kids, they take this bottled milk, and which is sugary, and so it starts that cycle of cavities right there. Okay, then by the time permanent teeth come in, they are already starting to get cavities before they are even fully formed.
Right.
Okay, so and the cycle continues because now there is so much treatment that you can't afford it. Dentistry is also very expensive, and it's a whole different podcast why it is so expensive, why it should be so expensive. So the key is diet and lifestyle changes right from your kids. If you have had bad teeth, there's no reason why your kids should have bad teeth.
Right.
If you truly give it your 100%, and the whole insurance mentality you have to get out of it. These are your teeth. They don't belong to an insurance company.
Right.
You don't have to wait for an insurance company to come save
to tell
your
you
teeth.
it's okay.
Yeah.
Yeah.
You know what is best for you. Before you eat your food, you don't call an insurance company. Is this insured? Can I eat this? Will you still cover me when I get sick?
Right.
Right.
So what you have to do is right from your kids, prevention. Anybody who comes in for a consult for a dental implant in my office, first thing I look is there a way to save what we have?
Yeah.
Because implants don't come without problems. Like I say, it's not one and done. It's not like that. That, hey, it's over. I got these implants and now nothing's going to happen to me. Yes,
Right.
you won't get
There is a
cavities.
mentality around that, so I'm glad that you said that. That's refreshing. Try to save the teeth first. Try to save the nerve
do
first.
everything that
Yeah.
you can to save your teeth.
Yeah.
Stick with what God gave you.
Yeah.
Okay, whatever we are going to give you will come with its own limitations.
Right.
Right. Absolutely.
So what's the actual success or failure rate of implants?
Implants, if they're placed right, the success rate is about 98%. The failure of implant would be if the patient has a systemic disease or deficient in vitamin D or is taking antidepressants. Some of those autoimmune diseases, that would be the reason for failure of the implant. Otherwise, it's a very predictable and very successful procedure.
On the off chance that an implant fails, what's the warranty?
In my practice, we give a warranty of 5 years. So if anything happens, we replace the implant at no cost to the patient. All the bone grafting that is involved is also done at no charge to the patient. In general, I think most doctors follow the same protocol.
What are the risks involved?
In general, there are no risks. If you are placing an implant very close to sinus, it could, fail and go into the sinus and then has to be retrieved. If you're placing an implant very close to the mandibular nerve, you could breach the nerve. That could cause permanent numbness in that area. But we use robotics in our practice, so all these, there's no chance for any of this to happen because based on the CT scan and the planning, the robotic arm already knows where the implant is going, so there is no risk of any complications.
Excellent. What is the maintenance like?
Maintenance is just like you maintain your teeth. Every 6 months, you show up for a cleaning so that we can clean around the implants. We also do bacterial disinfection around the implants with lasers. Also, at home, you floss around them. You get these little floss threaders that you use because natural teeth have gum in between them. The implants, because the gum is flat now, so you fill that space with implant. There's always a little space interproximally, so you got to keep it clean with interproximal brushes and good oral hygiene.
So what's the healing process on implants?
It varies patient to patient. Generally, healing takes anywhere from 3 to 6 months. This is the time when the implant osseointegrates with the bone. In other words, fuses with the bone. And for some patients, it's fast. For some patients, it's slow. Some patients, we are able to immediately load the implants when we have good bone support and primary stability. And for some patients, we always wait it out before we load them.
So can I chew my food with my implants just like I would with my regular teeth?
Absolutely. Go open beer bottles with it if you wish. There is no limitation there. And the good thing is they don't get cavities.
Now, unlike dentures, do you get whistling or any odd sound from having dental implants?
In some cases you do. When there is a little gap between the teeth because of the gum has receded. And for that, we generally do connective tissue grafts or tunneling technique to close those gaps. But there's no whistling. It's just a little air escapes through that little space, which is like right about at the base of the implant teeth. But there's no whistling.
Got a question for you from the friends. Can we get a gold crown on the implant?
Oh, you can get titanium, gold, diamond, whatever you wish once the implant as osseointegrated has fused with the bone and the abutment is in there. Well, it's your playground. Be creative, and we can put anything. There was this dentist who was placing diamonds, all over the rapper's implant teeth.
Wow.
Yeah,
That's a lot of cleaning.
Permanent grills.
Yeah.
Permanent grills. Yeah. So absolutely, you can do anything.
Nice.
So I know you're on the cutting edge. What's the future of implants?
Implant dentistry is here to stay. I've heard, that they will do stem cell implants in due course of time, which is still far way out. By the time it gets approvals and whatnot, we are looking at least a decade or two. But meanwhile, implant dentistry has been perfected. It is future-proof in the sense that if you lost a tooth and you got an implant, and later on you lose some other teeth and you're getting these implants, all of these implants can be connected and you can get a full mouth bridge. So in that sense, if you got a root canal and it failed, all that money has gone waste. With implants, they can be connected together to form a fixed bridge. So in that sense, it's future proof. As long as you plan it right, and they're not just randomly placed wherever, you can use your investment towards a full mouth bridge in future.
What is LANAP?
LANAP is an acronym for Laser Assisted New Attachment Procedure or Protocol. Essentially what it does is patients with mild to moderate periodontal disease used to be candidates for gum surgeries, which were very painful, and the acceptance rate was very low. With LANAP protocol, we use periolase, with which we basically think of a laser scalpel which separates gums from teeth without any cuts. Okay, and then we go in with piezo instruments and we clean out, smoothen the bone, and then we go in with another laser pulse which helps blood to clot, which we call hemostasis. And with this treatment, over time, patients regenerate bone and connective tissue. Say if you were a 7 millimeter pocket, that'll become 4 millimeter over 6 to 9 months. And patient acceptance rate is very high. There's no cuts, there's no stitches, there's no pain. Most patients are up and about the very next day. So acceptance rates are high, and it is very beneficial to retain your own teeth. I always say save your teeth so that you don't have to need dental implants ever.
Did you say it helps regrow the bone and the gum?
Absolutely.
That's
We call it
amazing.
regeneration. Yes,
Yeah.
You regrow your bone and connective tissue, and we have X-rays of hundreds of patients and there's so much research done that you can see these bone levels grow. It's miraculous. We've seen teeth with grade 3 mobility, very, very loose, which a general dentist is going to say, just take it out, and you splint them and you treat them with this protocol, and they grow bone. There are many cases like this, and a lot of research behind this. It's an FDA-approved protocol. It's not experimental, and it's been around 22 years.
Oh, wow.
Well, that really does fill the gap. I know a lot of people who, they're afraid of going to the dentist, and then when they finally do, there's so much work to be done, but something like this can really bridge the gap in the community.
Yeah, we've always said that, gum disease cannot be cured, it can only be controlled. But with this protocol, if we catch it in the right time and it's mild to moderate, it can be cured. And of course, then you have to go through the maintenance to keep it that way.
Thank you, Dr. Gill, for all of that. You are on the cutting edge of medicine. Now, before we go, I heard that there is a robot that you use for the implants. It's the Yomi?
Yeah.
Yomi? Somebody,
Yummy.
tell me about this robot.
Yes, Yomi is an FDA-approved robot which helps in placing dental implants. The way it works is that it has haptics. So one arm is attached to the patient's mouth, and the other arm is used to place dental implants. A CT scan is taken of any patient that comes in, and then it goes into Yomi Plan software where the case is planned, implants are planned, and once the case is ready to go, the robotic arm knows exactly where to place the implants with 0.01 millimeter accuracy. It's completely non-invasive, and if you're using Yomi, there's never a risk of breaching into a sinus or breaching mandibular nerve. Those risks are completely eliminated, and the precision is such that my hand can move, but that robotic arm, if the patient moves, it moves with the patient. So this is the beauty of haptics.
Yeah.
And it's incredible technology which is changing lives. And we routinely use it in our office to enrich the lives of our patients.
Yes, you are enriching lives for sure. I know that you're great with your patients. A lot of your patients come back. I know that you're great with families. We are so lucky to have you here today. Thank you for your wisdom.
Thank
you.
you.
Thank you for
Thank
all
you.
the cutting edge work that you're doing, because it's making it a little less scary, right?
Yeah.
It makes it
and
more
definitely-
practical.
Yeah, all this information that you're sharing with us is definitely making it, simpler for people to understand.
Because that's what we want the community to do. We want you to start taking action in your own life. Take care of your dental health through your nutrition, right?
And
Yes.
practice.
Making sure that you go to
Your
appointments
checkups
every
every
6 months. And what else did we learn? And if you are having some teeth that are loose, there's LANAP. So
Yeah.
LANAP is an option. That doesn't mean that you have to wait till they get much, much worse and run for a root canal,
Definitely. You
because
could
they're always
regenerate.
implants,
Yeah,
right?
absolutely.
If you really have to go down that route. And if you do have to go down that route, Dr. Gill's got you.
Absolutely. So, guys, thank you for watching. Have a great day.
Thank you. Bye.